تمام. Okay, I will start now. Hello, everyone. I am Batu Sultana, and I'm delighted to be here with you today. By way of introduction, I am a pharmacist currently pursuing a master's degree in human nutrition at the University of Glasgow in Scotland. Alongside my studies, I am conducting research with the SRA, where I serve as the media team lead. Additionally, I have the privilege of serving as the Associate Program Director of the RBB program. I'm thrilled to welcome one of our valued partners, the Uplifting Syrian Women Organization. Ms. Hajar, please feel free to introduce yourself and your organization to everyone.
Good morning, everyone. My name is Hajar Al-Halabi, and I am a volunteer with the Uplifting Syrian Women USW. First, I would like to introduce you to the USW initiative. It's a non-profit MENA award-winning digital platform dedicated to empowering Syrian women. Our activities include virtual courses, career workshops, mentorship programs, psychological support, and legal consultations. Our aim is to equip low-income and vulnerable Syrian women with the skills and resources they need to secure a better future and to heal from the trauma of war. On behalf of the USW initiative, I would like to express our sincere gratitude to the Syrian Research Academia and, of course, our esteemed lecturer today, Dr. Georgia Layton from the University of Leicester. It is truly an honor to be part of this exceptional event. Thank you.
Thank you so much, Ms. Hajar. I would like to take a moment to thank our media partner, Hakimak Dalilak, for their ongoing support. It truly means a lot to us. Next, I'd like to invite a very special guest, the Dean of the Faculty of Health Sciences at Damascus University, Dr. Samer Mohsen, who has been a key supporter of our work. Dr. Samer, we'd love to hear from you.
Has apologized for this meeting, and he thank you for all of you for sharing us with your valuable experience and valuable expertise. Thank you.
Okay. I'd also like to acknowledge and thank Professor Mustafa Zakkar. Yeah.
اجى الدكتور.
Okay. Dr. Samer, تفضل. Go ahead.
لا كملي خلاص كملي.
تمام. I'd also like to acknowledge and thank Professor Mustafa Zakkar and Dr. Ibrahim Antoun, who have joined us today. It's such an honor to have you both here. If you would like to say a few words, please feel free to do so.
صباح الخير، شكرا جزيلا على المجهود تبعكم وعلى تنظيم هذا اللقاء الرائع، يعني اللي ما كنا حنقدر نعمله لولا وجودكم والمساعدة اللي عم تعملوها لجميع الطلاب بسوريا. طبعا شكرا للدكتور سامر محسن لانضمامه إلنا. هذه الجلسات مثل ما بتعرفوا عم نحاول إنه نوعي الأطباء السوريين ودكاترة المستقبل كيف يعملوا ريسيرش، لأنه أي حدا بده يسافر أو أي حدا بده يطور المعلومات الطبية بيحتاج إنه يفهم كيف يعمل ريسيرش ويكون قادر على إنه يعمل ريسيرش. طبعا شكرا جزيلا لجورجيا. جورجيا واحدة من very promising جراحة قلب تشتغل معي وعم تعمل حاليا PhD وقدرت تاخذ واحدة من اللي بتعتبر أصعب المنحات الدراسية بأوروبا، وهي من البريتش هارت فاونديشن. وشكرا جزيلا لكم جميعا. Just to talk in English for a few minutes. So it is really my privilege and honor that Georgia agreed today to join us and give us a talk. As I mentioned, Georgia is a very promising cardiac surgical trainee. She is very good with her surgical skills, and most importantly, she has demonstrated that she is one of the most promising academicians in the UK. She has been successful in obtaining a very prestigious grant recently to support her PhD studies from the British Heart Foundation. So thank you very much, Georgia, in advance for sharing this very valuable lecture about systematic reviews today.
Thank you, Professor Zakkar, for your kind contributions. Finally, I'm excited to introduce Dr. Jamil Souqiya, the co-founder of our academy and the program director at RBB. Dr. Jamil, the floor is yours.
Is my voice clear?
Yes, now, yes.
Yeah, first of all, I want to welcome you all here in our RBB program, which aims to bring valuable experience and research expertise from outside Syria to Syrian students and undergraduates. I am Dr. Jamil Souqiya, a fresh medical graduate from Damascus University and a junior researcher with 26 published research articles. And it is honestly our pleasure to have Dr. Georgia Layton from Leicester University of Leicester here with us today to share her valuable experience. And honestly, we want to thank you, Doctor, for doing this, as it is really important for us to get this experience. I'm not going to talk so much. I'm going to let you introduce yourself and with our students. Here we have 2 lecture rooms, the one at Faculty of Health Sciences in Damascus University and at Sanad Center for Youth here in Damascus, in the capital. Please go ahead, Doctor.
Thank you. Good morning, everyone. My name is Georgia, and I'm a resident surgeon researcher in cardiac surgery working in Professor Zakkar's lab in the UK. I just want to say a big thank you for inviting me here. It's a real privilege, and hopefully I do it justice. And congratulations, of course, to Dr. Zakkar, Dr. Sultana, Dr. Antoon, and Professor Zakkar for organising such a fantastic series. I know it's been very popular. So we've published now a number of systematic reviews, and I'm going to tell you everything that I wish I knew as a medical student about how to design and how to write systematic reviews. I'm going to go through step by step, and hopefully you may have received some PDFs by email, which I will refer to during my presentation. I provide links at the end for everything that I'm going to refer to during my talk, and everything important will be on the screen. But if you do want to have a look at those PDFs, I'll reference that throughout the talk. So I'm just going to start with what is a systematic review. So simply, it is a structured way of collecting all the relevant research for a specific topic and then presenting it together to be read by a reader. And Georgia, they also...
Sorry to stop you. Do you want to share your screen with us?
Can you not see it?
No.
Oh, okay, sorry.
We can't see it, Georgia.
Say that again?
We cannot see the screen. I think we need to share the screen.
It was working. Has my share screen been revoked? Try again.
Yeah, perfect. Now we can see it, Georgia.
Yeah.
Fantastic.
It's not showing the right tab. Bear with me. So sorry. Better? Yeah, good. So, systematic review is just a structured way collecting all the relevant research on the specific topic that you're writing your review on, and then and presenting it to be read in a structured format. And it's one of the most highly regarded types of medical evidence that we use. But why is it so highly regarded? So a well-conducted review is reliable, it's comprehensive, it limits common forms of research bias that can limit the effectiveness of research that's being produced, and it inherently reduces some limitations of studies when they're presented independently. So it sits at the top of the pyramid of hierarchy of medical evidence, meaning that it is one of the most reliable sources of medical evidence. That is only if it is well performed and if it includes high quality data such as randomized control trials, trials lacking significant research bias. And by incorporating findings from many different studies, we reduce the impact of one single study's bias or one single study's limitations. And so it gives us a kind of broad and more balanced foundation to make clinical judgments and decisions with. And as I've already referenced, they are well structured, meaning that they're organized, they're highly planned, and they are performed to a defined framework and then reported to a defined framework as well in a similar way. And that means that they should be clear, they should be logical, and in theory, they should be easily reproduced by others who are reading your systematic review report. And fundamentally, this is the basis of all good science. So knowing where to begin is usually the biggest.
Sorry, Georgia, to stop you again. Someone is overriding the screen. Batul, can we tell them not to override the screen, please? And can you reshare your screen with us?
Yeah, sure.
Thank you. We can't hear you, Batul.
رجاء لا بقى حدا يشارك السكرين تبعيته. ما بعرف في حدا باسل علي، إذا بتريد لبقى تشارك السكرين تبعيتك على شاشتنا.
Yeah, we can see it now perfectly well. Thank you very much. Go ahead. Apologize.
No problem. So the hardest part of knowing how to write a review, particularly as a student when you've not done it before, is knowing where to start. So I'm going to go through what I think are the 10 critical steps to writing and publishing your first systematic review. So to begin a review, you have to have an idea. So you have to have a topic in mind. If you're lucky, you may have a senior colleague or doctor who will give you an idea about what a good review could be read upon. If you want to generate your own idea, the best way is to use your clinical experience. So if you think back to cases you may have seen as students where there were potentially multiple different treatment options available to a patient, and usually where treatment guidelines don't exist or treatment guidelines aren't sure what the best treatment is for that patient. And if there is already a lot of evidence supporting one specific treatment for a condition, a review is probably not going to be very beneficial for that specific topic because we already know what the best treatment to offer would be. So the review isn't really going to add anything to the literature. Compared to other circumstances where we're not sure what should be done, a circumstance called clinical equipoise. So basically meaning there is uncertainty of what the best treatment option is for the patient. So a good place to find inspiration for ideas in the UK, particularly, is going to what we call multidisciplinary team meetings, or MDTs. And I think Dr. Antoon mentioned these in his talk. So these meetings bring together healthcare professionals from different specialties to discuss and collaborate and manage the more complex patient cases or cases where there is uncertainty. And these meetings usually talk about patients where the treatment plan is not clear. And so it's a very good way to give you ideas and inspiration of areas of practice that we see regularly because we have patients in front of us with those conditions, but we don't necessarily know what the best way to treat those patients is. So these cases, of course, exist everywhere. So even if you're not in the UK, where you're working doesn't have specific meetings for this reason. When you see a patient, you overheard the discussions about how to treat them, or perhaps there's debate about the best way to treat them, then this can potentially be a good topic for you to think about writing a review on. And sometimes thinking of a new review idea, a unique idea, can be very challenging, especially if you're not working in a hospital yet a lot. So review ideas don't always necessarily have to be unique, because when a review is published, it is a snapshot of the research at the time that it's published. And then as time goes by, more research is performed, many reviews actually become outdated. So a good alternative to writing a novel review is to find a previously published review, as I refer to it as an old review. And any review can be updated if reasonable time has passed and if there's been new evidence published since it was written. So I would recommend reading this article that I've posted here from the BMJ, and the link will be at the end of the presentation, which gives details specific to updating old reviews, because I'm going to be focusing on writing a new review with a new idea. The easiest way, though, to check if it's appropriate to rewrite an old review is to read the review. Hopefully they have told you how they performed their review and described their literature research, and then you can perform the same search, and this will give you an idea or allow you to estimate how many new papers, how much new research may be available since this review was published. And there is no specific rule, but I would suggest that you want at least 5 years or so, and probably about 30% or more data to be available since the previous review to make it worthwhile while writing up a new review. So, as I mentioned, we're focusing on new reviews for new ideas. So you want to design a systematic review and you have an idea of what you want to write it on. So throughout this, I'm going to reference one of our recent reviews to demonstrate some of the concepts. So if you have received it, it's PDF 1, and it's referenced again here at the top of the presentation. So this review, which we wrote recently, was looking at the level of a blood protein called osteopontin. And this is a protein that circulates in the blood and is strongly associated with cardiovascular diseases and vascular inflammation. And we set out to establish, is there any association, any link between people who have coronary artery disease and their blood plasma levels of osteopontin, which we commonly abbreviate to OPM. So we're simply looking for correlation between a clinical condition and a blood test. So to design your question, you have your idea in mind, you can use the PICO framework. So you take your idea and then you answer 4 easy questions to help determine what your research question is going to be, what you're going to ask. So firstly, you're going to ask yourself, what population or what patients does this affect? So this review, we were looking at studies which included patients who had suspected or proven coronary artery disease, and what they all had in common is they have risk factors for coronary artery disease in one way or another. So to answer the question, which population will supply data to this review, we asked in patients or studies with including, so in studies looking at patients with suspected or risk factors for coronary artery disease, that was our population. And you want to be as specific as you can be here to make sure that your final review is very targeted and is relevant to what you're trying to, the question you're trying to answer. So secondly, you want to determine what treatment or what exposure or what a diagnosis that you're trying to evaluate. So for interventional studies, so studies that are looking at a specific treatment process, this is usually very clear. It may be a specific surgery, it may be a specific drug. It's what your patients or some of your patients are going to be given, and is your what is going to influence the outcome or not. And so for reviews like the example I've given, our recent review, we were looking at an exposure rather than an intervention, our exposure being coronary artery disease. And sometimes for non-interventional studies, your intervention, your exposure can be less obvious. So for us, we're evaluating the impact of having coronary artery disease on the circulating levels of this protein. And so our exposure is having or not having coronary artery disease. So if our exposure of interest is having coronary artery disease, then our comparison is patients who do not have coronary artery disease or who have less severe coronary artery disease. But if we were evaluating an intervention, for example, if we were looking at coronary artery bypass graft surgery, then our comparison may be patients not having surgery or patients having an alternative treatment such as PCI and so on. And finally, our outcome of interest in this example is, of course, our blood level of osteopontin protein to determine if there is a correlation between our exposure and our outcome. And so in following the PICO structure, we've developed our research question. So the final research question for this review was, in patients with risk factors for coronary artery disease, that's our population, is having coronary artery disease, which is our exposure, compared to not having coronary artery disease, correlated with the blood level of osteopontin protein. And now we know what our question is that we're trying to answer. We can go on to determine the inclusion and exclusion criteria for our review. So your inclusion and exclusion criteria are the main part of what we would call your systematic review protocol. Now, your protocol is just your instructions of how you are going to write or perform your systematic review. And it's important that you write your protocol before you actually perform your review. And I will come back to this. So I'm going to reference something called Prisma, and I'll reference it a couple of times throughout this talk. It's an excellent free resource that gives extensive, very clear outlines of structures for all the key documents for any kind of systematic review and meta-analyses. It's a framework that stands for the preferred reporting items for systematic reviews and meta-analyses, and it's a set of evidence-based guidelines that have been designed to improve transparency, ensure consistency, and ensure that your final systematic review report is complete and isn't missing any key information. So it ensures that the reader at the end, when they have your systematic review, can assess the validity, the reliability, and how reproducible your results are. And it gives them confidence in your final output. And very helpfully, as well as kind of describing the evidence base and the guidelines, it gives you very clear checklists that you can use when you're writing your documents. And it also gives you templates for figures and diagrams that should be included in the majority of systematic reviews at the time when you finish writing them. And again, I will come back to these later on. So the purpose of your systematic review protocol is to basically justify why you're writing the review, to give a little bit of context. It should also describe in detail the methods that you're going to use for the reasons that I've described in terms of validity and confidence and so on in your results. And you may choose to follow the Prisma protocol checklist, and that will tell you all the information that should be included in your protocol when you're writing it. You may choose not to follow that, and that's absolutely fine. But ultimately, the purpose of your protocol is just to communicate clearly and in great detail your methodology and your research question before you actually go on to do your review. And it should also describe how you're going to do your literature search, so how you're going to find all the research and the papers that will be included in your review, and how you're going to ensure that you are including all relevant research as best you can from the field. So part of your protocol will describe the search terms and the search strategy that you're going to use for your literature search at the very beginning of your systematic review. So, oh, sorry, that is frozen. There we go. The most important part of your protocol, outside of describing the methodology, is your inclusion and exclusion criteria. So this tells the reader, but ultimately you and your team, whilst you're performing your review, which research should be included and which research should be excluded, shouldn't be included in the review because it's not relevant or it's not looking at the right populations. And you can write out your inclusion and exclusion criteria using very similar PICO structure that you use to write your research question, and then also including some additional information about, for example, the study type and the population. So some aspects, such as defining our population, defining our intervention, should be very clear from when we wrote our research question. And generally speaking, if you write your inclusion criteria first, your exclusion criteria will simply be the opposite of your inclusion criteria. So your inclusion criteria may be as simple as you're including, or you wish to include, all studies that evaluate patients with coronary artery disease, and you wish to exclude studies that do not evaluate patients with coronary artery disease. Other criteria, such as the type of paper or the type of study design. So is it a review? Is it a research article with original data? Is it a case report? Is it an abstract from a conference? You may wish to filter by country of publication, age of participants, patients who have or do not have certain conditions, and it's going to be very, very specific to your initial research question. These criteria ultimately become your checklist for screening your papers later on, and therefore the more specific and the more descriptive you can be now, the easier it will be down the line to carry on with your review. So once you have written your protocol, you should aim to publish it so that it is out there in the public sphere and it's available for a variety of reasons. So we choose to publish ours on Prospero. Prospero is an international register for systematic reviews, meta-analyses, protocols. in humans or in animals, and it's got a focus on medical sciences. So it's free. It gives you a very, very nice Word document template that you can use to write your protocol. And I have given you an example of our Prospero protocol for our osteopontin review, which is PDF 2, if you have that to hand. So publishing your protocol hopefully reduces duplication of work, so you can search for other people's protocols and similar themes. Is somebody already writing a review and in your idea, in which case you probably don't want to continue with your review at this point. It reduces your risk somewhat of selection bias and reporting bias because you're identifying your methodology before you perform it. So hopefully it limits your subconscious or even conscious manipulation of your methodology based on the results that you found. Later on, when it's published, it supports peer review, and it signals to publishers that you have conducted your review well because you have your protocol published many months before you're submitting your review to be published, and they can compare and contrast and see that you did actually do what you set out to do. And again, this just gives them confidence that the biases and so on within your review have been limited. So PDF 2 is our OPM review protocol. So on the right is what Prospero looks like, the website interface, very easy to use. You can search it like a database. And the templates for writing the protocol from Prospero give you a really nice structure in the Word document with headings, as you can see here. So it asks you for your research question, how and what you're going to search, what types of studies should be included, and so on. So it's a really nice structure if you're not sure where to start in terms of writing a protocol. So as I mentioned earlier, a key part of your protocol is going to be your literature search strategy. So this is how you're going to identify research for your review. Now, of course, all these initial steps that I've described are going to happen simultaneously. They're all going to happen at the same time. So you should know how you're going to do your literature search before you publish your protocol. Practically speaking, how do we do it? Well, at the most basic level, we're searching medical databases to find relevant papers to be included. Now, there are many, many databases, certainly more than I've listed here, and each database has its own pros and cons. You will choose what is most relevant to your work, what you have access to use based on your university logins and so on. We commonly use PubMed and Embase, but I will also use Cochrane quite regularly if I'm interested in finding clinical trials to interventional trials. PubMed is excellent because it has very broad indexing, so it has lots of clinical and non-clinical papers. Everything that is indexed in the PubMed database is peer-reviewed, but it does also include abstracts from conferences, systematic reviews, meta-analyses, and so on. So it has a broad range of paper types. The main problem with things like PubMed and to some extent Embase is that it does favour papers published in English. It lacks broader inclusion from research outside of Europe, unfortunately, and this automatically, of course, introduces a degree of selection bias in the studies that are going to be shown to us from our searchers. Generally, your university access is going to determine which databases you use, and as long as you use at least 2, that will limit your biases some. So searching all of these databases basically entails deciding what words, what keywords you're going to search for. And I usually do this by simply thinking about my research question and writing down all the key concepts, all the keywords that are related to that question. And you want to be sure to use all possible ways that people will just commonly describe in literature the condition that you're referring to. So if we come back to our example research question, if we want to find all literature relating to coronary artery disease, so this is very commonly described in many different ways. So it may be coronary artery disease, coronary stenosis, coronary obstruction, ischemic heart disease, and as well as different terms to describe the same thing, it's also important that we include different common ways of spelling these words. And I think the majority of those differences tend to be between British and American English. So for example, ischemia has an extra A in British English and so on, but you'd want to include the different spellings as well to be sure that you captured them accurately in your searches. And once you have your list of keywords and terms that you're going to use, you want to combine them together in a way that the database is going to understand. Now, to do this, you have to go database by database, because each database has different rules and different ways that the database will pull terms out of research. So you're going to have to read specifically the different functions of each database, but broadly speaking, these functions are called Boolean operators. So they can be very simple. So for example, in PubMed, it can be using and or between terms. So depending how you combine them determines how broad or narrow your search is. So if I'm searching for, say, coronary artery disease or osteocontent, that is going to give me all papers relating to the first term and all papers relating to the second term with no overlap. If we use the word and, then it will only pull research or retrieve data that has both terms incorporated within it. The searches can get very complex, and to some extent it is important to make them more than the basic to ensure that you're getting all the relevant data. But these niche searches, you know, I could probably talk about for hours about just searching PubMed. So this is something that unfortunately you do have to sit down and kind of read through the detail yourself. If you are conducting a review in a topic where there are thousands of papers, so for example, cardiology, there are hundreds of thousands of papers for common terms, performing a very specific search is incredibly important to make sure that your final review size, the number of papers that you're including and reviewing, is manageable. And so these more complex search functions are called tags. So they are very small characters that you add to your search strategy in various positions, and they will tell the database to perform more advanced forms of searching, which can help narrow or broaden your search. So just to give you an example of how this can work and why it's important. So when we search PubMed, for the PubMed database for the term coronary artery disease, and you'll notice here that I've put it in quotation marks and speech marks, and that means that the database is going to search for this specific phrase, coronary artery disease, as a phrase and not as just a theme from within the research. I've followed it by the tag for title searching, so that is square brackets containing T and I. Now when I search, this is going to look for all research listed on this database that uses the phrase, the specific phrase, coronary artery disease in the title of the research, and that gives us 35,000 results. When I do the same thing again, moving to the second image below, I have used the tag for title and abstract searching. So this is going to search for papers that use the phrase coronary artery disease, not only in their title, but also in their abstract. And as you see, that gives us a much larger number of results. That gives us 111,000 results. So that's just one small way of how a tag can actually triple the number of papers that you're getting. And what you want to do is find a balance of ensuring that you have all relevant research, so finding a large number of papers when you're searching your database, but also ensuring that it's still manageable, because it is not possible to perform a review if your final number of abstracts to screen is 100,000. It's just not humanly possible. So another common function that I use is something called mesh terms, so medical subheadings. These are unique to PubMed, but most databases have their own equivalent of these, and they're just basically standard vocabulary, and uses all articles on PubMed are indexed using these terms. So they're basically put into groups and categories if they relate to the overarching subheading term. They're what we call hierarchical, meaning that the broader terms kind of tend to sit at the top, and everything more niche relating to that is sitting within it. And they just allow a really nice structured approach to your searching. So again, using coronary artery disease as an example, the medical subheading for coronary artery disease incorporates everything listed here in the bottom left of this diagram. So you can see that by searching the medical subheading of coronary artery disease, I am simultaneously searching for different ways of spelling that. So artery disease, coronary, coronary atherosclerosis, diseases of the left main stem, and so on. So by using one search function, I have been able to search for sort of 12, 15 individual themes and phrases. So it just makes your search far more comprehensive, which is particularly important if you're doing niche reviews that are going to not have a huge volume of research available. So this is not the specific search that we used for this review, but just an example to demonstrate the concepts. So what you should end up with when you have written your final search strategy is a cluster of terms that, when combined together, exclude irrelevant work, but include all the papers that are likely to be relevant and important to your review. So reassuringly, when I did this search, the first result that pops up was actually the review that I'm referring to, so that's good. And you may choose, as well as using the terms and the tags to limit your searches, you may choose to limit it by things like studies evaluating humans and not all animals, published after a specific date, particularly if you're updating a review. There are many ways that you can do it, and I recommend that you read into it specific to the database that you're going to use before you conduct one. But all the databases will allow you to save your searches as CSV files. So you're going to download a CSV file, and then I'll come back to this file shortly. So we've performed our literature search. We have all the papers in our downloaded CSV file. And now what we need to do is compare them to our inclusion-exclusion criteria that we wrote earlier. So to do this, you read the paper, you go through your inclusion-exclusion criteria like a checklist. If it meets all your inclusion criteria, doesn't meet your exclusion criteria, then it would be included in your review. This can be a very slow process. It, of course, takes a long time to download and read just one full text. So if you have a large number of papers, you may choose to actually first screen your abstract. So compare your abstract rather than the full text against inclusion and exclusion criteria. So you can then do a second round of review after hopefully excluding lots of abstracts and do the same with your full text. And this just limits how many irrelevant full text you will read. And this process should be performed independently by at least 2 people. So at least 2 reviewers, 2 authors, just to make it as objective as possible. And certainly occasionally reviewers will disagree. So I might look at a full text and say, I think this should be included. My colleague may read the same one and say, actually, for these reasons, I think it should be excluded. And we simply have a discussion to come to an agreement and decide together, should we include it, should we exclude it? And it's very important that this whole process is well documented, because you have to report on all these steps during your final review when you want to publish it. So a really useful tool to help automate this process is a website called Rayan. So it's web-based. It was designed by Timo and Qatar, I think. And its whole purpose is to help conduct systematic reviews by streamlining the process of screening and selecting your studies. It's free. You can create an account, and I think with university access, you can have up to 3 reviews at any one time, and overall as many as you like to do. So the CSV file that we downloaded from our databases, we upload them onto Rayan. It has a really nice user-friendly platform. You just upload as many database files as you have collected, and it combines them all together. And the first thing it does is it uses artificial intelligence to exclude duplicate papers, which is very useful. And certainly if you are searching multiple databases, you should expect some duplicate papers to be found. That's reassuring. And then each reviewer, hopefully 2 if not more people, are going to blindly screen these abstracts and full texts and record their decision. And by blindly, what I mean is that I should be doing this separate to my colleague. We shouldn't know what the other person has determined, so that it doesn't influence our decision. So the interface, each paper just flashes up in turn, usually with an abstract. You can select the button to include, you can select a button to exclude, you can also put the outcomes and the reasons for the decision that you've made. And you can see that in the bottom diagram here on the right. So you know, the first paper, all 3 reviewers selected to include, the second paper, all 3 reviewers selected to exclude. And there's a little tag there for wrong outcome. So the reason that we excluded it is because it's evaluating the wrong outcome. And again, all the results of your screening can be downloaded in an Excel spreadsheet, which again is really useful for developing some figures for your review that I will describe later on. So after all these processes and these steps that we've taken, we have performed our literature search, we have screened our abstracts and our full text, and that leaves us with a number of papers that will be taken forward and included in our final review. So these are all papers that have met all our inclusion criteria, do not meet our exclusion criteria, and multiple reviewers have all agreed they should be included. So the next thing we need to do is evaluate any bias that may exist in these studies. And to do this, there are many, many ways to do this. Ultimately, we should be using validated bias tools to assess the risk. There are 3 tools, or 2 tools really, that I would recommend using. So for observational studies, which is largely what was included in our example osteopontin review, there's something called the Joanna Briggs Institute tools. And again, I've put the links for this at the end of the presentation. These are specific to the study type, but they just ask questions of the study related to its methodology to help you determine whether or not you think there is a significant risk of bias in the results of the study. If your review is interventional, so it's evaluating a treatment or a procedure, then I would recommend that you use the Cochrane bias tools. So there are 2. There is one for non-randomized studies, so studies that have given one group of patients a treatment, another group no treatment, but they haven't been randomly assigned to those groups. And then similarly, but specific for randomized studies, the ROB2 tool. And these tools they're very long, they take a long time to use, but they are excellent resources. Their websites have huge amounts of information about how to use them, the impacts of bias, when you should be using them. And you can also download Excel spreadsheets that have the tools in it, as well as descriptors of when something would or wouldn't meet the relevant criteria. So they do take a long time, but certainly they are standardized and would be accepted broadly by any journal really at the end. So the aim of all these tools is the same. So you want to look at the same parameters, common sources of bias across each study, and make a judgment as to whether you think the way that they have performed the study has impacted the study findings. So do we think the study findings are truly representative of our intervention, or do we think actually something else has influenced the results? And this is important to do at this stage, because you may actually choose to exclude papers from your review if they contain very, very significant amounts of bias and you don't think that they are viable to their results are worthy, basically. A bias assessment is a key part of any worthwhile systematic review, and you should be including a summary table. So there are a variety of ways to present summary tables of what your bias assessment was. And this one here is an example of one of the Cochrane tools that's been used, and then this is how they've presented their bias to the reader. And your final bias assessment will answer questions based on questions such as, are your study groups similar? Were there any significant differences between groups, and have these been accounted for? Is the overall conduct of the research positive or negative? Has it influenced its findings? And of course, as we know, bias can pertain to randomization, confounding, there may be missing data, it may be that the groups have been treated differently, or how intervention was performed or how outcomes were measured was different between groups. There may be selection bias or reporting bias and so on. So these tools are very comprehensive, and they just really help you interpret how reliable our included studies are. And so any study that has very significant bias, you can choose to exclude. So for the interventional study tools, the Cochrane tools, these actually give you very clear guidance about how many categories a study can meet risk of bias before it should be excluded. For non-interventional studies, so the Joanna Briggs tools that I mentioned earlier, this is less clear and it's far more subjective, and you just have to use your judgment. So When you have made an assessment of bias, hopefully what you will have is a table that can look something like this. So again, this is our example bias table from our example review. And the structure of the table will completely depend on what tool you've used. Because this tool and our studies were not interventional, this tool is qualitative, not quantitative, so it's just descriptive. We can't predict how the bias may have impacted the study findings. All we can say is that there is some risk of bias or there is low risk of bias. If this was an interventional study, though, for example, it's usually possible to comment on how you think the bias may have impacted your findings. So you may be able to say that there was branch selection bias, and therefore we think this has overestimated a treatment effect or underestimated a treatment effect. So if it's possible to, you should also not only identify the bias, but also make a comment on how this might have impacted the findings and in what direction. So we have our list of included studies, we have evaluated them all for bias, and we've determined that they're all credible enough to be included in our review. We now need to extract data from these studies, and for interventional studies, there tends to be a lot of numerical data, so numbers of patients in specific groups, percentage of patients with comorbidities, duration of survival, and so on. What data you're going to collect depends completely on what your research question is and what you're reviewing. So coming back to our example review or osteopontin review, we collected a lot of descriptive data about the study, but there was so much difference, what we call heterogeneity, between all of the studies. So no two studies were significantly similar. So it was not possible to do any form of kind of quantitative, numerical and statistical analysis. So all our writing about these studies, which you will note if you go on to read that review later, is largely descriptive and more of what we describe as narrative review. Regarding specific analysis, I would like to recommend that everyone watches Dr. Bassiano's talk from the same series last week, which I know goes into a lot more detail about the analysis for systematic review and meta-analyses. But fundamentally, you want to statistically combine outcomes between multiple studies and determine whether they support or reject your clinical question. And once you've performed your analysis, you need to structure your results. And the easiest way to start thinking about the content of your review is by creating a summary table of all your included papers. So this is a very standard table you will see in all systematic reviews that presents each study. It gives its reference and describes basic characteristics such as the study settings and its population and the key findings. You may want to include relevant outcome measures if it was interventional studies, so maybe time to death or percentage of group survival and so on. And this just helps you understand each paper in detail by writing this table, and then helps you when you're moving on to the writing process. And writing the actual results and the discussion of a review can be challenging if you haven't got experience of doing this previously. So if you go again back to our example review, you will see as you read through our results and our discussion, we grouped the papers based on what they were evaluating. So you'll find initially a paragraph describing studies where there was some form of similarity. So studies that were looking at coronary risk scores, studies that were looking at acute coronary syndromes, studies looking at stable angina, and so on. And all you're aiming to do is find common themes amongst the papers, even if they are broadly very, very different, which sometimes they will be. And for meta-analyses, quantitative reviews, the approach would still be the same. You'll still group your papers into those which share outcomes or show outcome changes in similar directions. And now you have an idea about your studies, you've followed all the steps, you have all the key content for the review. The only thing left to do is to physically write it and create the document. The easiest way to do this is by using the PRISMA framework. So I referenced this earlier. This again is just evidence-based guidelines and a checklist that improves kind of the transparency of your review. It makes sure that you don't miss anything important, and it can help you structure your review because you can simply take the checklist and write your Word document in line with the items that you're finding on the checklist. when you've generated your final manuscript, if you've used Prisma, which hopefully you will do, you should reference this in your text. You should include the completed checklist in your, for example, your supplementary materials. So if you look at the checklist on the screen here, on the far right, there is a column that says location where it is reported. So this should include a description to your reader of where they can find this information in your final manuscript. So, you know, rationale, describe the rationale for the review and in the context of existing knowledge. Hopefully this would be found somewhere in your introduction, for example, and you would put that in that column. And so that should be available to the reader at the end when you also have presented to them your manuscript. And another key part of Prisma and another key figure that you'll find in any review is a Prisma flow diagram. Now, you may not use Prisma, you may not use this specific diagram, but a figure of this sort should be in your review. This is used to communicate to your to your reader where you found all your included papers from, when and why you excluded papers from your search, and the Prisma template is just a very clear way of conveying that. So as an example, this is the Prisma diagram from our osteopontin review. So as you'll see at the top left, our literature search identified 196 papers, and straight away we excluded 4 because they were duplicates, because you can't evaluate the same record twice. 192 of our papers were screened, so we looked at least the abstract of 192 papers, and after this process we excluded 100 papers because they met some of our exclusion criteria, they didn't meet our inclusion criteria. And the reasons for exclusion at this point have been categorized into incorrect study design, incorrect population, and incorrect publication type. If we did have any interventional studies, which we didn't on this occasion, another common reason to exclude papers here would be incorrect intervention. So, for example, if you were evaluating patients receiving, say, aspirin versus placebo after coronary bypass surgery, there may be several studies that evaluated clopidogrel versus placebo. This, of course, is not in line with your study protocol, and so those papers would be excluded, and you would note down that they were excluded because they have given the wrong intervention. And we tried at this point to look at the full text of 92 papers, but unfortunately we weren't able to get hold of 2 just for access issues. So these had to be excluded as reports not retrieved, meaning that we were able to look at the full text of just 90 out of the 92 papers. And again, we excluded 57 more due to meeting the exclusion criteria. So finally, after starting with 196 papers following our database searches, 33 studies were included in our final review. And you have all this information, you've created your figure, now is time to write your reports. And your systematic review report will follow the same basic structure of any paper. So an introduction, a methods, a results, a discussion, and a conclusion. And key things to include beyond this are all listed in the checklist. So of course, you want to include your flow diagram, you want to include your tables summarizing your studies, your table summarizing your bias, and then you want to have a comprehensive discussion of the results of the papers, their findings, and you may want to also include at least a paragraph discussing the sources of bias in these papers and how you think that may have influenced their outcomes. And your discussion is your interpretation of the evidence. So it's the most subjective portion. It's what you think these findings mean to your outcome in your review. And always remember that any discussion should never include new facts. So anything that you're commenting on in your discussion should already have been at least briefly mentioned or highlighted in your results. So what do I mean by no new information in discussion? Coming back to our example review, the OPM, in our discussion, we talk about positive correlation between osteopontin blood test levels and the severity of coronary artery disease. So my results should clearly provide detail and description of all papers that mentioned this association earlier, and then I can refer back to them within my discussion. Your results are for presenting facts and presenting numbers. Your discussion is for interpreting them and sharing with the reader what you think they mean. And If you followed all these steps, in theory, you should now have in front of you the first draft of your first systematic review. And what you, of course, want to do is publish it. So the first step is to share your draft with your co-authors. Hopefully they provide helpful feedback. They will suggest some changes to be made, and you need to choose a journal to submit to. Often it's useful to have someone experienced, someone more senior perhaps, to help you do this. But ultimately, you want to make sure that you choose a journal that has aims and interests that align with the topic of your study. You want to make sure that it's going to be read by your target audience. So if your review is about surgery, you want it to be read by surgeons. And all journals will have a website. They'll describe their scope, they'll describe their audience, and you just want to make sure that you're selecting the right journal from the beginning. You can also look at things like journal metrics to decide whether the journal has enough influence and prestige to warrant receiving your review. Impact factor is a commonly used metric, and that's effectively how frequently a paper published in that journal is then cited by other researchers. And of course, there are very famous high impact journals, things like the Lancet, the New England Journal of Medicine, and so on. And broadly speaking, the higher the impact factor, the harder it is going to be to have your work accepted there. But certainly, impact factor is not the only metric. There are things like alt metrics that determine how much engagement with social media papers get when they're published in that journal, and so on. One thing you do want to consider as well is cost. Unfortunately, there is cost for many people to publish articles in journals, particularly open access, meaning that they're available for anyone to read. This can be tricky because if you're not supported by university funding or a grant, then it can be difficult. And I do know I have been in situations where I've had work accepted but haven't been able to pay for the fee, which is unfortunate. And just a word of warning, there are an increasing number of predatory journals, and these are very unethical publications that kind of exploit the open access peer review publishing model to profit from authors. So they charge very high fees, and they don't necessarily provide normal publishing services that would be expected of legitimate journals. So they prioritize money over scientific integrity, and they don't have proper peer review process and so on. So effectively, they will let you publish anything as long as you can pay the fee. And red flags for these kind of journals are things like if they suggest skipping peer review, or peer review is very, very short, just a couple of days. They send lots of aggressive emails, and then they rapidly publish something within days following its submission. And the main risk is that you can lose a lot of money, and they also don't tend to be indexed in PubMed and databases. So they're not really well regarded in the scientific community and won't really count for some applications, particularly in the UK. So just be careful when you're choosing your journal for that reason as well. But hopefully, once you've selected your journal, you've submitted your work, then you have completed your systematic review after much time, much energy, and hopefully it is published in due course. So just to summarize, sorry, this didn't follow my speaking. So you've completed your systematic review and you've achieved what you set out to achieve probably many months after you started. So just to summarize, remember that the most important parts of a good systematic review are having a very clear, very specific research question that explains exactly what your review is aiming to achieve. You should have a detailed protocol, as detailed as you can make it, and particularly your inclusion and exclusion criteria should be very, very detailed. Spend a good amount of time writing and testing your literature search strategy before finalising it. And most importantly for reporting, keep very, very clear records throughout the process of which papers have been included and excluded and why you are excluding them at each point of your screening process, because it will be very important to report this later on in your review. And thank you very much for listening. Sorry for the technological challenges. I'm very happy to answer questions, and hopefully you found this useful.
Thank you very much, Dr. Georgia. It was a very interesting lecture. For me, I am very thankful for this lecture because I have systematic review for my dissertation.
Nice, good.
Yeah. Before we start the questions, I want to take a moment because Dr. Samer want to say something.
Just one moment.
Okay.
Is my voice clear?
Yes, clear.
Okay, Professor Samer Mohsen, the Dean of Health Science in Damascus University, are going to speak with you.
Hello, good afternoon.
Good afternoon, Doctor.
Okay.
I want to thank you very much for your efforts and sharing your experience with my colleague, Dr. Georgia and Dr. Zakkar, and I will thank Jamil Souqiya and his team for giving us this opportunity to host this activity. And I appreciate your time and appreciate the time of my colleagues and my students. Indeed, we are in the period of examination, and this means how much they are interested in doing research, especially doing systematic review. Thank you very much again, and I wish to have much more collaborations with you, and see you inshallah in next activity. Thank you very much. Sorry for not preparing myself to speaking anything. Thank you very much.
Thank you very much.
Dr.
Thank you.
Samer.
Thank you so much. Appreciate that.
I will start the questions. Bashir, do you have a question in Sanad?
Yeah, in fact, we have one question. Do you hear me?
Yes.
I have a question for Dr. Georgia. First of all, thank you very much for this opportunity. Your expertise are much appreciated. I have a simple question. If time went back to when you first started doing research and systemic reviews, would you recommend starting doing systemic reviews and research alongside each other, or do you recommend to get a hold of research first for original papers and then starting systemic reviews?
I think systematic reviews, particularly small ones, are a really good way to learn about research. By doing systematic reviews, you are forced to read many research papers. And one of the easiest ways to develop research skills is to just read research of other researchers and how they've done things. And particularly the appraisal process and determining bias of studies really helps you think critically about what is good and what is bad about the research that's been done. So I think they're a really good way of students entering into research exposure, definitely.
Thank you. I have another question. He said, my questions is... What?
We have questions from the lecture room. Go on. My question is, can we take non-published studies on our reviews, and is that a criteria to or is that does it affect on our reviews quality if the studies is published or non-published studies?
Yeah, I would say that it's bad practice, or it's best practice to include only studies that have already been peer reviewed and published within your review, because if the study has not been published and hasn't gone through peer review, there's potentially significant bias, significant limitations that haven't been addressed, and they're only going to be compounded if they're then included in a review. So it reduces the overall validity of your review findings.
Okay, thank you, Dr. Georgia. We have another student. A student want to ask a question.
First of all, I would thank you, Doctor, for sharing your experience with us. My question is, after how many years we can make a systematic review on an old topic, or it doesn't depend on time?
It depends on time, some. If a review was published recently in the last 1 or 2 years, there's likely to not be very much new data available. So updating the review is probably not going to be successful. There's no specific time. I would say generally at least 5 years or more. Ultimately, you need to just be sure that there is a lot of new data. If there is, many papers since a review was previously published, regardless of time, it's reasonable to maybe update it. But the paper that I've listed here, hopefully you can still see the screen, tells you when and how to update systematic reviews, goes into that in a bit more detail. It could be quite useful.
Jamil, do you have another question?
Yes. Hello, Doctor. Good afternoon. I'm Sidra Hamoud, a clinical psychologist student. I have a question on step 6 while assessing the biases. What is our role in assessing biases? Like, do we have to judge the biases, or is it a specific criteria that we have to do without our judgment?
So if I can show you, maybe perhaps I can go back. If you are evaluating interventional studies particularly, so studies that have looked at a specific treatment and treatment effect, it's usually possible to determine whether you think the bias has influenced the findings of the study. So if you can see the figure on screen here, the final column on the right is an overall judgment. And effectively, that is your judgment based on the criteria within the tool of whether or not you think there has been an impact from the way they've conducted the study, or whether you think that the findings truly represent what the intervention effect is. So just to give an example of this, you may be evaluating whether giving steroids before bypass surgery reduces post-operative infection rates or something. So the role of assessing bias in this study would be to say whether the overall findings are truly a reflection of the science and the impact of the treatment that you're giving, or whether actually there are many things within the study that could have influence the results. So to put it simply, your role in terms of determining bias is basically saying whether or not you believe the findings of the study, and do you think they are valid and reliable enough to be truly considered the impact of the treatment and not the impact of other factors. Does that answer your question?
Can I just add something quickly, just to remind everyone that actually this is not done by one person. So you're going to have the whole group who are contributing to the paper doing this assessment of bias, and it will be the consensus later after everyone discussed what they think the bias is the final decision. So it's not one individual, it's a whole group.
Okay.
She had her answer, and we have the last question.
First of all, thanks a lot, Dr. Georgia. I have two questions. The first one is, how come systematic reviews and meta-analysis are at the apex of the research when they are not per se original pieces of work? And the second, what is the difference between systematic review and meta-analysis?
Good question. So to answer your first question, they're only at the top of the pyramid if they contain good data themselves, and that's why bias assessments and your screening process is so important. If you have, so the highest level of evidence as an individual paper is going to be a double-blinded randomized control trial, for example, because inherent to its design, you have limited research bias as much as possible. If you have many, many studies all together and you combine them into a very high quality systematic review, you have increased your population size, you have effectively combined resources to create one piece of work with one final judgment that has contained only very high quality data. So they're at the top if they contain good data, because they effectively just allow you to evaluate more patients than you could ever evaluate in one independent study. And of course, that also includes using different units, different surgeon experience, different countries, and so on. It basically makes your results as generalizable to a broad population as it's possible for them to be. But of course, that's only if you're putting good data into them in the first place, which is why it's important to follow such structure. Your second question about the difference between a meta-analysis and systematic review, broadly speaking, the difference is in the analysis and the statistical analysis that comes. So all meta-analyses are a form of systematic review, but not all systematic reviews can be a meta-analysis. So the example that I gave you here, the osteopontin review that we performed, could not, if we had been able to, we would have done a meta-analysis. But to do a meta-analysis, you have to have data from studies that have a degree of shared methodology. They have to be looking at similar data points and outcomes, because you can't combine together outcomes if they're not looking at the same thing. So there are many, many similarities, and the main difference is just whether or not you have the statistical capacity to combine your results together at the end to perform an overarching statistical analysis. Would you agree, Mr. Zakkar?
I totally agree. So basically, every meta-analysis in reality is a systematic review and a meta-analysis, because you have data, you are able to generate these nice graphs. And as Ricardo said in his previous lecture, it's about the diamond at the end, which side it is. But not every systematic review is a meta-analysis, because some of them, like the OPN one, there is no numerical data that we can collect. But if you can collect the data, you definitely have to do it as a meta-analysis. And probably a nice example is a previous one that we've done, looking at FFR in coronary arteries as a marker of how tight the coronary arteries are. So we combined both a systematic review, but we had enough data to do a meta-analysis.
Thank you very much. Jamil, anybody else have a question?
Georgia, go ahead, Batul, with your questions.
Yeah, okay. I have a question here from the online session. My question is related to registering the protocol on Prospero and current academia environment of racing to publish systematic reviews and meta-analysis studies. I am now hesitant to prospectively publish the protocol as one of my paper I registered got published by 2 other groups a few months later without having any registration.
Unfortunately, there is some unethical practice in research, some places. It's important as upcoming researchers that we understand what is ethical and what's not ethical, and we uphold the ethics as best we can. There is a risk of that, of course, but any notable journal that's publishing a review would be aware of that, and certainly not having a published protocol or publishing a review with a protocol that is the same as something published by another group would not be accepted by most high quality journals, really. There's no real way around it, unfortunately, but I do recommend sticking with accepted good practice, which is publishing it in advance, and hopefully bad practice like that will slowly become less frequent.
Thank you. Another question, when conducting a systematic review, do we have to review articles written in languages other than English?
In theory, best practice would be to complete your reviews in all relevant articles, regardless of the language they're published in. Our reviews inherently have a small degree of bias, because we always look for reports published in English, because we don't have the capacity to read and translate them to many other languages. If you have the capacity to read articles published in other languages, the process would be exactly the same. You would include them in your review in the same if they met your criteria. And certainly that would be great, because it would exclude bias from geography.
So just to add, one of the ways we go around this is actually when we are putting our inclusion and exclusion criteria, we say that we're going to include only articles in English, for example. and exclude other languages. But if you don't want to do it this way, you can remove it from your inclusion-exclusion criteria. But you have to be specific with the criteria, whether you're going to be using one language, two languages, all languages.
Thank you. I have another question. What's the best number of people on a team for conducting a systematic review? And is it possible to conduct a good systematic review without having people who have had experience in the type of on this type of research, or would it be jeopardize the quality?
There's no specific rule. The larger your review and the more papers you have to screen, the more reviewers you will need, simply for time. I'd say a good number for a small review to start with is maybe 3 or 4, hopefully having 1 or 2 additional people with some experience, more senior than you, to help supervise you, guide you, give advice. But certainly you can do a review just as one person, although then you wouldn't be able to have the dual screening. So I'd say the minimum is 2. That there is no maximum, but obviously you want to make sure everyone contributes equally. So above sort of groups of 8 people or beyond, you really have to justify having extra people.
Okay, thank you. Another question, how would you approach surgical interventions in terms of risk of bias assessment, as surgical trials have trouble with blinding?
So that's not a problem necessarily specific to reviews, but is to interventional trials. So those tools that I presented earlier for interventional studies, the ROB2 and the Robbins I tool, both have questions about things like blinding, randomization process, standardization of intervention for different groups. And certainly if someone's having surgery, it's unlikely to be blinded, so there would be a degree of bias introduced from that. And these are the kind of things that you would put into your discussion, the kind of things that you would comment on when you're talking about the bias judgments that you've made.
Okay, thank you. What about Google Scholar as a database? And can you talk about search strategy on the Google Scholar to use it?
So you can use it. I've never used it for my reviews. I use it in practice, just not as a search for the reviews. So I'm probably not best placed to tell you about it in detail. Ultimately, you can use any combination of databases and tools to search for papers, as long as you highlight them and you describe them in your project and you appraise all papers equally. It doesn't matter which database overall they come from. You want to make sure that you're using databases or repositories like Google Scholar that have broad ranges of research so that you're not accidentally missing key papers. And something that I tend to do when I'm writing my literature search strategies is I think of key papers relating to the topic that I would consider essential to be found by the literature review. And then when I test my search strategy before I finalized it, I search through the results and make sure that every search does include those papers. Say I usually choose 3 or 4 and call them my essential papers, and I know that if they're not being identified, then my search strategy is not good enough and I need to go back and edit it before I finalize it.
Thank you. And the last question, do you recommend using the grade tool in every systematic review?
To be honest, I have not had a huge amount of experience with it. I do recall using it in a previous review, but we didn't use it in our recent review. I don't know if anyone else has experience with it.
So I think it depends really on the review itself. So we definitely, as far as I remember, we used it for the FFR. So it all depends on what kind of material you are talking about and what kind of topic. Okay, and that's why you can use all these different tools. If you want to use a grade for everything, that's absolutely fine. But on occasion, you will find that the grade won't fit. And definitely it did not fit for the OPN review. So we had to use something else. As far as I remember, I think grade more fit with kind of when you have more numerical data. So it all depends on the systematic review or the meta-analysis itself.
I think grade is similar to Prisma in the sense that it sets out guidelines for you, but whereas Prisma is focused on how you're reporting the data, grade is more to do with how you're analyzing the data. So it's more relevant to meta-analyses rather than systematic reviews, which is why that's Ricardo's area of expertise, not mine.
Thank you very much. Thank you very much. Before we wrap up, I want to take a moment to express my heartfelt gratitude. Dr. Georgia, thank you so much for being with us today. Your insights and contributions have made this session truly valuable, and we deeply appreciate your time and presence. I would also like to extend my sincere thanks to Professor Zakkar and Dr. Ibrahim for their continuous support and dedication. Your efforts truly make a difference. A special thank you as well to Dr. Jamil Souqiya for initiating this incredible program. It wouldn't have been possible without you. And of course, our partners, Uplifting Syrian Women and Hakima Dalila, thank you for your collaboration and commitment. A big thank you to Dr. Samer as well for making it possible for the Health Sciences College to be part of this initiative. Lastly, to everyone who joined us today, thank you. Your engagement and presence mean a lot to us. We look forward to seeing you again for the 4th session with Dr. Daniel. Once again, thank you all and see you soon.
Prof, you want to say a few words to the uplifting?
Yeah, of course, you can.
So,
thank you, Georgia. That was very useful even for me. So lucky my list is cancelled. So I'm very happy to attend. So a couple of words in English. So thank you, Georgia. First of all, very nice. I'm pretty sure everyone has benefited. I want to especially thank Uplifting Syrian Women. I think they're doing a great job. I had a visit to their website yesterday. Amazing job in very difficult circumstances in the country. So I just want to say thanks to them specifically, along with Batul and Dr. Suki. I just wanted to say thanks. That was very useful, and the support they're providing for Syrian women is pretty impressive.
Georgia, thank you very much. As usual, another outstanding talk. Makes me very proud of you. Thank you. And thank you everyone for putting this program together, for attending, and Dr. Samuel Mohsen for attending. Thank you very much. And definitely Uplifting Syrian Women. And I spoke to them briefly before we started, and hopefully we're going to have another chat later on. So thank you everyone for attending, and have a good day. Thank you very much.
Shukran, Batul.
Thank you very much. Thank you.
Bye-bye.